It's time to talk about one of our pet segments today, and today we're focusing on heart disease in our animals. And with us today is Dr. Jerome Williams, our regular guest. Our special guest today is Dr. Casey Ray to explain ultrasounds and how they can work when diagnosing the problems like that in our pets. Gentlemen, good morning.
Good morning.
Good to see you. Dr. Williams, when you do you discover that there's something going on that you can't really see in your office and you would send them to a specialist, or how does it work?
Yes, absolutely. We determine that that's something that is not normal. If we want to get to the bottom of it, find out exactly what's going on, then we refer to a specialist like Dr. Ray.
And Dr. Ray, you said sadly though, there's really no symptoms to head it off before there's a big problem. Is that right?
That's correct. I mean, sometimes you see some coughing, sometimes some exercise intolerance, but usually there's no real outward symptoms that pets have, because pets really, especially cats, really hide their symptoms. It's
cats aren't very active anyway in most cases, so is that how it's hidden sometimes, or?
Until their heart is bad enough to go into actual failure.
Oh, wow.
Most of the time, unless the veterinarian detects a heart murmur or an abnormal rhythm on when they listen to the stethoscope, then a lot of times there's just nothing that can really be. All right, well, you brought an
ultrasound to show us this is how you do it. It's basically just like you do with a human, right?
It is. It's just like you do with a human. The gold standard for diagnosis for heart disease in pets and people is echocardiography. Basically, it's an ultrasound of the heart. And with that, you can see all the different chambers and valves and see if things are leaking, which is a big thing that can happen. You check the thicknesses of the heart to see how big the wall thickness is.
Now, can you discover something before it's too late, and are there treatments, or is it a matter of keeping an animal comfortable?
Well, you can discover before it's too late. That's really the reason why we need to take your pet to the vet, especially even your cat, especially yearly, to listen, just for a physical exam, and to listen whether or not they have a heart murmur or something like that. That's usually the very first symptom.
So, Dr. Williams, if you have a regular checkup, you would be listening for those type of things?
Oh, yes, absolutely. We look for exercise intolerance, the color of the tongue, whether there are sounds that are abnormal with the heart, whether it's a muffled sound.
So while we as owners may not, our moms and dads may not notice something, you would notice something in a checkup.
Yes, but some things you can notice at home is exercise intolerance or the color of the tongue. Those are two main things that you may notice at home. Say, hey, this just doesn't seem like it used to.
What's going on with the tongue? What color? What do you?
Well, it turned more blue, more purplish.
Okay.
Normally we should have a nice pink or red color, and because the oxygen.
Unless they're a chow.
Unless, yes, yes, absolutely.
All right. So when you usually when a pet comes to you, what's going on?
Usually the veterinarian has seen something that they're concerned about, so they decide that they want to call me in and see whether or not that there's more there going on. So what I do is I travel to their office and do the ultrasound in their office.
So this is your portable ultrasound?
It is a portable ultrasound machine, yes it is.
And I know when you're looking at it here you can't see much, but if you were looking at, how would it work if you were looking at a pet like Jillian?
You would, basically the image on the screen would be, anybody could tell it was the heart.
Okay.
I mean, you could see all the different chambers and valves, and it would look just, depending on the angles, it would look just like the pictures that people put in textbooks.
And then with the ultrasound, you're able to see all the internal components of the heart.
Okay.
So that's the advantage of having a Dr. Ray come and do an ultrasound. That way we can know whether we've got a valvular problem, whether the wall is thickened, and why the heart is enlarged, which chamber is.
Because it may be something that can be fixed.
Oh yes.
Okay.
Not repaired, but certainly medication can help.
To live.
Yes, extend the lifespan and make them more comfortable.
Okay, so today, I guess, what's the takeaway for us talking about this? What's the message that you would like Dr. Ray for our viewers to know?
I think the message is know that it's common, and also know that that's why the yearly checkups are important. Nowadays we have 3-year vaccines, and I think a lot of pets are not getting to the veterinarian, especially cats, which are sadly sometimes forgotten. And that's why it's very important that they get to the vet at least once a year.
So reiterating those yearly checkups much more are really, really important. So not just for the fleas and the shots and those other things, but heart disease as well. Thank you, Dr. Ray.
Oh, you're welcome.
Dr. Williams, good to see you.
Thank you.
Jillian hiding over there.
Yeah, Jillian's sort of behind
her heart's perfect, right? All right, thanks guys. All right, now here's Jay.